In this video, I'm going to discuss first aid kits, specifically vehicle-based trauma first aid kits, how to set them up, what they should contain, and what I carry inside my first aid kits. So stay tuned.
Yeah, the other teams are moving in the background.
Welcome back, Carlos here with the Range 11 Tactical. On this channel, we create content full of useful tips, techniques, and/or drills just like this one to help you build and/or expand your tactical knowledge base. So if you're new here, consider subscribing. Okay, before I get into the actual trauma kit, I kind of want to discuss my thought process and kind of where I've evolved to over the years with my med kits. I used to carry, a full tactical bag full of medical supplies, but over the years I slimmed that down drastically. I've noticed that, sometimes less is more, and the more you learn, the less you need. So now I basically break my med kit down into two distinct categories. This one here is kind of basic first aid, and I'll talk about this one briefly. And then this one here is my actual trauma kit. We'll go into full detail on that. So this is my system here. These are the two bags that go inside of my Tacoma here. I have a very similar setup that goes in my wife's vehicle and one that goes inside the home. As you can notice, it's a very slimmed down package, so it fits almost anywhere in the vehicle. So very practical and convenient to have with you at all times. So let's get to it. Alright, so this is my standard or routine kit. As mentioned, I have my kits broken down into two distinct categories. This one here is intended to treat minor injuries such as small cuts, bug bites, rolled ankles, basically all your non-life-threatening injuries. It contains band-aids, sterile strips with iodine swabs to treat minor cuts, gauze, saline solution. I got ACE bandage, triangular bandage, just to treat maybe those rolled ankles or hurt wrists, so on and so forth. This kit also contains some over-the-counter medication. The ones kind of to treat those most common signs and symptoms. So acetaminophen for maybe a headache or a fever, ibuprofen for maybe some inflammation, Benadryl in case somebody gets an allergic reaction to something, Imodium, antacid, and Pepto-Bismol tablets to treat those stomach conditions. This kit here is the one that actually gets the most action when we're out, camping and or four-wheeling, something like that, because it's intended to treat those minor injuries that happen, through routine daily life. This kit here can be stored anywhere in your vehicle because there's nothing in this kit that is intended to treat life-threatening injuries. I actually keep this kit in the back of my truck in the lockbox, and I get to this kit as needed. Okay, so this is my trauma kit. This kit here actually sits inside the cab of the vehicle with me as I need to have instant access to this kit. This one here is intended for life-threatening injuries where time is critical. That could be anything from I'm going down the highway and I roll up onto a major accident, or I'm involved in an active shooter situation and I'm treating a gunshot wound to a victim or myself. For you military and law enforcement personnel, this is nothing more than a beefed up IFAK, individual first aid kit. So it has, instead of one tourniquet, multiple tourniquets, so on and so forth. So let's open this one up. I'll show you how I store the items and what's inside. Okay, so as soon as I open up the kit, the very first thing I have in here, kind of in the center, is some latex gloves, PPE, right, personal protective equipment, and some shears in case I got to cut away some material or maybe even a seat belt. From there, what I use is TCCC's, Tactical Casualty Combat Care's M.A.R.C.H assessment to organize this kit. As I'm doing that assessment, I use the items in that order, right? I'll do a full video on the M.A.R.C.H assessment later. For now, I'm just going to go over the items and glance over the M.A.R.C.H assessment so you can understand why I have the items that I have in this kit. Okay, so using that M.A.R.C.H assessment, right, the M for in M.A.R.C.H stands for massive hemorrhaging or massive bleeding, right, which is our number one priority as soon as we arrive on scene to treat that, that traumatic event there. So front and center are my tourniquets, right? Those are to deal with massive bleeding to the extremities. I have a soft T and soft T and a cat T. In addition to that, I also carry a SWAT T or SWAT tourniquet. This one is like those exercise bands that you see. This one is good. It's not my go-to, but I like keeping it in the kit because I can treat patients with small limbs such as children, where maybe that soft T or that cat T just can't do the job, right? Continuing on with the M in the M.A.R.C.H assessment, this pocket here contains all my gauzes, right? These are to plug holes and to stop major bleeding in the transitional areas where the tourniquets can't be applied, right? So some rolled gauze, some combat gauze, just a bunch of different gauzes here to kind of plug those holes there. So right between the tourniquets and the gauzes in this pocket, I pretty much can address everything that has to do with the M in the M.A.R.C.H assessment. All right, moving on to the A and the R in the M.A.R.C.H assessment, airway and respiration. That's this pocket here. Of course, as soon as I open it up, if they're breathing on their own, no big deal, but I do have an MPA in the event we have to open up an airway. And then for the respirations, of course, the chest seals in the event there is some penetrating trauma to the chest region there. That in conjunction with my 14 gauge needle to kind of relieve the pressure. In addition to that, I also carry 2 CPR masks. Of course, these are not part of the M.A.R.C.H assessment, but definitely good to have in your kit. All right, so next step is the C, which stands for circulation. Nothing in the kit for that. Simply, 2 fingers on the wrist, checking for a radial pulse, and that's it, right? So after that, last step is the H in the M.A.R.C.H assessment, which stands for hypothermia. For that, I carry a space blanket. Once I'm done with my M.A.R.C.H assessment and I'm treating those injuries in that order, simply wrap the patient up in the space blanket and treat for hypothermia, and that is pretty much it. As you can see, there are not a lot of items in this kit, but this is all you really need to treat that major trauma and increase patient survivability until that next level of care arrives, or you can transport them to that higher level of care. Okay, so those are my first aid kits. I urge you to go out and make your own kit or buy one of those pre-made kits and keep them in your vehicle at all times. That's one of those items that you don't really think you need until you absolutely need it. In addition to that, I urge you to go out and get some training. I'll be making a follow-up video down the road on Teachable C and the M.A.R.C.H assessment, as I feel it's important to share that information with you because it does no good to have all those items if you don't know how to use them. Lastly, if you found this information valuable, leave me a comment. Consider subscribing to catch my latest videos. With that, stay safe and train hard.